Good day and good morning to everyone in the ITTP participant, and I'd like to present my case paper about surviving critically severe COVID-19 infection case as a clinical pathology perspective. And for the introduction is that COVID-19 has been here for almost a year and 5 months, and there has not been a fixed guidelines, so it's still an interim guideline that will be updated day by day with a new research and stuff. And for the COVID infection itself, the high mortality rate is still there, as especially for the severe and critically patients, even after using mechanical ventilators and ECMOs. As for the case report today is that this is a 36 years old man with a typical symptom of fever and fatigue, and the patient has been brought to the hospital, and while in the hospitalization the patient started to have a difficulty to breathe, and then admitted to the ICU in the secondary hospital, and then referred to our hospital in the tertiary hospital to the ICU as well. And for the history of the illness of the patient, that this patient has the hypertension and diabetes mellitus with lowered oxygen saturations. In the laboratory examination, we can see that there is a decrement in the hemoglobins, and the typical leukocytosis and high NLR ratio, neutrophil lymphocyte ratio, and as well as this is thrombocytopenia. This anemia and the thrombocytopenia, even though it has been given transfusion of packet red cells and thrombocyte concentrate, the patient has not been improved while in the critical conditions. And this is the clinical chemistry. There has been found hyperkalemia, hypokalemia, and the increasing of blood urea as well as creatinine serums, and the typical of increasing the CRP, and as well as a very highly marked procalcitonin that might be caused by the infection. And then the patient has also been diagnosed as diabetes mellitus with high level of glucose and receive insulin, and as well as the antibiotics for the infection. And for the blood gas analysis, the patient during the admission in the ICU, there has been the condition of hypercapnia, and the patient has been given ECMO as well as continued on mechanical ventilators with PF ratio that quite low, with in the 9th. Here the PF ratio is about 69, so it was a very it's below 100. And then for the coagulation studies, it has been found that there is an increment in the dimer levels as well as a somewhat normalized the dimer level, and this might be due to the condition of fibrinolysis shutdown, and this is we can see in the TEG there has been found lysis 30% of 0.5 and 99 in the 19th of May, maybe due to the fibrinolysis condition, hyperfibrinolysis condition, and it also the patient got very high BBD and BDD. Sorry, and as well as this is the TEG, and this is the RT-PCR, and this is the cultures of bacterials, and this is the thorax X-ray of this patient. And this patient, of course, that's a very complex condition that this patient got the anemia and the thrombocytopenia and such. And for the anemia, the most possible one is due to the it's either in this patient there is a bleeding or the increased destruction, but we have not been able to find the exact source. And the thrombocytopenia in this patient might be due to the typical trapped megakaryocyte lymphocyte in the lung, and also might due to the consumption to the hypercoagulable condition of this patient. And for the high NLR ratio, it's very typical, and the higher the NLR, the severe and the poor prognosis of these patient conditions. And there's also might be a kidney acute kidney injury in this patient, shown by the increasing of the creatinine ratio and the uricretin ratio. In some research it has been viewed that it can predict the severity and prognosis of this patient, and it might be this condition due to the hyperactivation of renin, angiotensin, aldosterone system. And might be in some case there is this weird deficient of ADH release. And for this inflammation, the typical increasing of ferritin, procalcitonin, and IL-6. And this is the ARDS might be usually due to the COVID-19 infection, very typical. And this is for the hypercoagulable states. It has been found that the condition of this patient it can be shown by the dimer. The increase in the dimer may be it's indirectly show that there is an hypercoagulation in the body, with shown, as well as there is a condition of fibrinolysis shutdown within in the 10th of the May, and it causing the dimer levels to decrease below the level to the normal level, but the condition of the patient is still severely critical. So it might be due to the fibrinolysis shutdown. So there has not incapabilities of the fibrinolysis system to clear out the thrombi in the body. And in the 18th, there's increasing in the dimer level, which shows that the fibrinolysis shutdown has been decreasing, and the condition of the patient improved in the 20th and 21. Which is returning of the fibrinolysis system in the patient body. So for the conclusion is that this case report illustrates how difficult it was to predict the condition of the severe and critical patient, that we are unable to predict the outcome, even though we can already giving the optimal supportive or giving the optimal therapy, and as well as maintaining the body physiology. So there's an open opportunity. There is still a lot of open opportunity for the researchers to analyze the data that we have right now. Further investigation, such as maybe using the machine learning as well, and also it showed that it needs more research to predict what will the severe and the critically COVID-19 infection patient. Thank you.